Hello, everyone, and welcome to this panel presentation on public benefits with Cindy Huddleston, Valory Greenfiel, and Miriam Harmatz. Cindy is an attorney with over 35 years of experience advocating to strengthen public assistance programs for low-income Floridians. Before joining the Florida Policy Institute, she worked at Florida Legal Services and Legal Services of Greater Miami, where she represented indigent clients to maximize access to programs that provide work supports, such as Supplemental Nutrition Assistance Program, SNAP, Reemployment Assistance, and Temporary Assistance for Needy Families, TANF. Cindy has extensive experience as an advocate and lobbyist for policies that promote financial security for all Floridians. Valory Greenfiel obtained her bachelor's degree with high honors from the University of Florida, where she majored in sociology. She received her law degree from the University of Miami School of Law and is a member of the Florida Bar. Val was a staff attorney and later department head in the Public Benefits Unit at Legal Services of Greater Miami for 11 years. Thereafter, she served for 19 years as a senior staff attorney at Florida Legal Services, providing training, consultation, and litigation support to statewide advocates in public benefits. She joined the Florida Senior Legal Helpline at Bay Area Legal Services in 2015. Miriam is one of Florida's leading Medicaid advocates and is a former senior health law attorney at Florida Legal Services and adjunct professor in the Health Law Clinic at Florida International University College of Law. She founded the Florida Health Justice Project in late 2017, where she is the director of advocacy. So thank you, Cindy, Val, and Miriam for joining us today. And Cindy, take it away.
Thank you so much for having us and for everyone who's attending. I'm Cindy Huddleston of Florida Policy Institute, and I'm here today in this particular part of the session with Valory Greenfiel from Bay Area Legal Services. And we're going to talk about some of the ways that seniors can maximize their SNAP food assistance by claiming excess medical deductions. SNAP is a really important safety net for seniors, and maximizing food assistance is going to be more important than ever in the coming year and a half. And this is because, among a host of other reasons, during the public health emergency, states have been prohibited from disenrolling individuals from Medicaid while the public health emergency is in effect. But as disenrollment rolls back in after the public health emergency is over, some people will very likely lose their medical assistance and need ways to maximize their other safety net benefits like SNAP. So after Val and I talk a few minutes about SNAP, we're going to turn the floor over to Miriam Harmatz of the Florida Health Justice Project, who's going to talk about the whole unwinding of the public health emergency and how that impacts seniors and how to minimize the impact on clients. Many seniors in Florida are eligible for a number of safety net programs designed to assist them with their basic needs. Even so, though, over 20% of seniors 60 and older live below the federal poverty level. So the Supplemental Nutrition Assistance Program, SNAP for short, and also still referred to as food stamps, it plays a really important role for over 600,000 seniors in the Sunshine State. Many SNAP participants, including seniors, are extremely poor and live on fixed incomes and don't have the financial means to afford adequate food, medical care, and their housing costs. But SNAP provides, a modest benefit of about $162 a month per household member on average to pay for groceries. Now, this 162 average is even with USDA's reevaluation of what's called the Thrifty Food Plan, which it did in 2021 for the first time ever since 2006. In the reevaluation, USDA increased SNAP maximum allotments to about $8.38 per week per person. And although this is modest, don't get me wrong, this adjustment is long overdue. And it's a really great first step towards ensuring that households, including households with seniors, can meet their nutritional needs. But is it enough to put, protein and produce on the table all month? No. So the excess medical expense deduction is extremely important to a lot of households. It enables seniors to kind of shift the resources that they would otherwise have spent on food towards, other immediate needs that they have. In fact, it's really kind of more important now than ever. If families who aren't having to rely on SNAP to put food on the table are having problems containing their grocery costs, particularly right now, if those families are struggling, you can only imagine how hard it is to put food on the table the whole month if you're a SNAP participant on a fixed income. And we know that while SNAP does a really good job of getting eligible people into the SNAP program in Florida, we can do better, especially for seniors. The latest data from FNS puts the percentage of eligible seniors participating in SNAP in Florida at just a little over half. So there are a lot of seniors who are not participating in the SNAP program. And one way to up participation is to make sure that seniors know they may be eligible for more SNAP than they thought by taking advantage of the SNAP excess medical deduction. While the medical deduction plays such an important role in ensuring that households with high medical costs receive adequate benefits, it's extremely underutilized. Very few households with seniors, and I think it's about under 20%, claim excess medical deductions, particularly for things like transportation, eyeglasses, and over-the-counter medications. And at the same time, though, available data shows us that the share of households who would be eligible for those expenses is really much higher. So what is the excess medical deduction in the SNAP program? Certain people are allowed to have DCF deduct unreimbursed out-of-pocket medical expenses in excess of $35 each month from their income when determining their SNAP eligibility. The practical effect of this is that it helps lower the household's net income and boosts the SNAP benefit at the same time. And just FYI, as we'll be talking about, although folks can deduct a lot of costs, they cannot deduct things like costs for a special diet, for example, Ensure. And here's a tip. Products with a nutrition label on them, like Ensure, can normally be bought with SNAP benefits, but that also means you can't count them as a medical expense. If they have a nutrition label on them, they're really not going to be able to count them as a medical expense in the SNAP program, although you're very probably likely to be able to buy them with your SNAP benefits. So who can get the excess medical deduction in the SNAP program? Persons aged 60 and older, and that includes people who turned 60 in the month that they apply for SNAP, and persons with disabilities. And that means people who are getting some kind of disability benefits, and there's a catalog of those benefits that qualify in DCF's policy manual and in federal regulations. Those folks can deduct out-of-pocket medical expenses in excess of $35 each month. The medical expense deduction works like other SNAP deductions if you're familiar with the SNAP program. It takes the deduction from the entire SNAP household's gross income, even though it only counts the medical costs of the individual senior or the person with the disability in the household, and not those of other household members, unless, they too are seniors or have a disability. There's no cap on the amount of medical expenses above the $35 a month threshold that a household can deduct. However, in most cases, your health care provider must have, ordered the item or service that you're trying to deduct. It doesn't mean that you have to have a prescription fill in a prescription form for every service or item, but there has to be some direction by the healthcare professional for you to be able to deduct that cost. Here is some authority for the deduction, with the most important really being the federal regulations and DCF's policy manual. And as you can see, one of the authorities is a USDA policy memorandum about medical marijuana and other legal substances. And just so you'll know, for now, even if you have a medical marijuana card, you cannot deduct those expenses from your SNAP benefits. That may change in the future. I haven't heard that there's any move afoot to do that, but as of now, that is not something that you're going to be able to deduct. Deductible medical expenses include costs for just your general health care, like your doctor, your dentist, hospital expenses, acupuncture, health insurance premiums like your Medicare copays, prescription medications, transportation costs to obtain medical treatment, including transportation costs to get to the drugstore to pick up your medication, to buy over-the-counter medication that's been prescribed for you, to purchase, some kind of, health supply that you might need. You can deduct those transportation costs. Homemaker, attendant care, child care or housekeeping services that you need because of age or because of a disability can be deducted. Health supplies like eyeglasses and contacts, dentures, incontinence supplies. That's a new one that DCF just added in the past 2 years. Hearing aids, prosthetics, batteries for your hearing aids, denture cleaning supplies, those things are covered. Prescribed over-the-counter medication, which, as I mentioned, is one of the most underutilized items in the medical expense deduction arena. And that would include things like vitamins, pain relievers, antacids, ointments, non-food supplements like glucosamine, all, if it's authorized or prescribed by your medical professional. Medical supplies like eyeglasses, oxygen, pain magnets, walkers, canes, wheelchairs, other pain relief equipment, commodes, those are all covered. And by the way, if you rent one of these devices or supplies, the rent that you pay can be deducted. Service animal expenses like veterinary care, food, and other costs for your service animals can be deducted. And by the way, one of the biggest increases I have ever seen was for someone who was vision impaired and claimed excess medical expenses for a service animal. And her benefits increased by over $100 a month when she claimed them. And finally, other medical related and health expenses and supplies, like a humidifier, some kind of medical alert device. In other words, it's quite expansive. The kinds of things that you can get a deduction for is quite expansive. So you should look at this as not a complete list, but to give you an idea of things that you may want to think about with clients when they're trying to up their SNAP benefits and things that they could possibly request be deducted from their income. As I said, these deductions are way underutilized, particularly transportation costs. We know, because FNS has done studies of this, we know that very few seniors claim their costs for traveling to the doctor or going to the drugstore to get their medication filled. But if they did, that could really add up. And those costs can be deducted based on, the actual cost. For example, how much it costs you to take the bus, or by using the state employee allowance, which is at 44.5 cents per mile at the moment. DCF understands that things can change. So you can always report additional medical expenses to DCF during the certification period. DCF may ask you to verify it, but it has to act on the change. They have a duty to do that. It doesn't matter if you haven't paid the medical bill yet. Medical expenses that you have incurred but haven't paid can be deducted. But note that the interest that you pay, for example, on a credit card for medical expenses that you're paying off on cannot be deducted. At the same time, if you take out a loan to pay a medical bill, you can deduct your monthly payments, but you can't deduct any interest that you're paying on that loan. And I don't want to get into the weeds too much because I think the takeaway today is just that the medical expense deduction is out there to help up the benefits of seniors. But I did want to say that past due medical bills probably can't be deducted unless they're being paid on or there's some kind of payment agreement that's been developed. Nor can an expense be deducted if it will be reimbursed at some point in time. Also, you can deduct the expense all at once, or you can average it out over your certification period. So you have the choice to figure out what benefits you the most each month with your SNAP benefits. Federal SNAP rules require that the amount of any medical expense to be deducted must be verified. Also, in many cases, DCF may also ask that you verify that a qualified health professional ordered the item. In my experience, it's rare that DCF asks that, but it's certainly something that they could do. So if you're familiar with SNAP, you know that there are a lot of different ways to verify things depending on what you're trying to verify. And the usual suspects for excess medical deductions on ways to verify are through receipts. You know, keep your receipts from the drugstore to show how much you paid for your glucosamine or your supplies to clean your dentures. You know, invoices, an actual copy of your prescription from your doctor, a statement, just a quick handwritten statement from your doctor on a notepad saying, I told Mrs. X, Y, or Z to buy glucosamine. A collateral contact. And a collateral contact is a third-party contact, usually done over the phone by DCF when they're unable to verify verify something in another way. You could give, for example, DCF the phone number of your doctor, and they could call and make a collateral contact to verify that, yes, your doctor has directed you to take glucosamine. But if you've tried everything you can to verify deduction, but you can't, what you need to do for certain is to tell DCF about the problems you're having and ask for their help in obtaining verification, because they have a duty under state and federal law to provide that help if you're trying to get the verification yourself but can't do it. And hopefully, to make it a little easier, here's a link to a toolkit that you can use to fill out and submit to DCF to claim excess medical expenses. You know, but you don't have to use this form to do it if it doesn't work for you. Although I think it can be a good reminder of some of the expenses you can deduct, and it is DCF approved. And so let me try to show you what this looks like. Okay. On your screen, I'm hoping that you see a copy of, you don't see it.
No.
Okay. Yep, seen it yet?
No.
Okay. And I am going to go back to my original.
There it is.
Okay. So here is the toolkit. And this is just, I just wanted to show you, give you an example of what it looks like. We tried to put it in font so that people could read it no matter what their vision was like. And it just essentially will prompt you about some of the costs that you may have that you need to be able to tell DCF about. I just wanted you to see what that looks like and just feel free to use that. And one bonus about this is a form that has actually been vetted by DCF. So they're on board with this. You don't have to use it, but if you do, it's something that they have authorized. So now I want to hand the reins over to Valory Greenfield, who's going to go over an example for how using the SNAP excess medical deduction can really make a difference in clients' SNAP benefits. Val?
Hi, so we're going to talk about a mythical woman that I completely made up out of my head named Iris Fleur, who is not to be confused with my actual charming colleague at Bay Area Legal Services by the name of Iris Flores, who has graciously agreed that I could use a variation of her name in this hypothetical. So the reason we're going to talk about Iris, Ms. Fleur, is because we want to see how the actual medical expense deduction will help her in, and we're going to do a food stamp budget for her without the medical deduction. And then we're going to dig a little deeper into her facts, and we're going to do another budget with the expense deduction. Generally, the amount of SNAP that you get, the amount of benefits you get, depends on your income, less some formulaic deductions and allowances and credits. The resulting number is compared to the maximum allotment that you can get in the food stamp program, and that calculation will then determine how much you can actually get in benefits. So I'm going to talk to you about the facts about Ms. Fleur, and then we're going to demystify the whole food stamp calculation process by showing you a magical worksheet. Anyway, Ms. Fleur is a 79-year-old woman who rents an apartment on her own for $800 in Pasco County. Her only income is Social Security of $1,650 gross monthly, which is higher than the income limit for her to be able to get help under the Medicare Savings Program. So that's a tip to you of an expense she might have, meaning her premiums for medical insurance. She does not pay property taxes as a renter and does not carry insurance on the structure because she's not the owner. She has air conditioning in her apartment. Now, we know these things because shelter expenses are relevant for everybody's food stamp budget. So these are kind of the preliminary questions you're going to be asking your clients, and as well as about the income, because the income is clearly going to be relevant. Ms. Fleur has found it difficult to make ends meet these days. So for the first time ever, she's applying for SNAP. She wants to make sure it's going to be worth her while because she knows it's kind of, a difficult application process, especially for the seniors. You do a SNAP budget for her, and you find that she's going to get the minimal allotment of $20. Now, you tell Ms. Fleur that may not seem like much, but it is like getting a $20 coupon every month for the grocery store, and you want to encourage her to use it. So some of the numbers we're going to look at on the next slide. Oh, actually, the next slide this is the interactive magical worksheet that, that Cindy discovered and passed on to me, and I am now happy to tell everybody about it. The link is at the top, but you can also just type into your search engine the title of the form, which is CF-ES 3002. It will pull up this form, and that's what we're going to use in a moment to actually figure out Ms. Fleur's food stamp amount. It's an interactive form, and you clear it at the end and you pull it up timelessly for every client you have in order to figure it out. You'll also need to look at Appendix A1, which is in the DCF program policy manual, because that's going to tell you some of the numbers you're going to need to plug into this worksheet. Now, some of you may not want to get down into this level, but I just wanted to show you the worksheet. Let's go to that now so that we could demystify this process a little. So I hope that you can see that some of the numbers are darker black and some of the numbers are lighter and gray. The numbers that are lighter and gray are numbers that I had to write into this worksheet in order for it to automatically populate the numbers that are darker. So I want you to first pay attention to the top right, where I entered her income. It's unearned income. So I wrote 1650, which is her Social Security. And then that populated at line 3B and then got transferred, in fact, to line 5D. So the form does that for you. But I did have to put in the standard deduction, which I looked up, as I mentioned, on Appendix A1. It's $177. As I said before, the food stamp calculation process includes allowances and deductions, and that's one of them that everybody gets. It's $177 for a household of her size, which is a single household. Look to the right at box 6, and so far we don't know any medical expenses, so that's automatically populated a 0 in that category. But just below that, in the box on the right, you see shelter expenses at number 9, and I've put in her rent at $800, and I looked up on Appendix A1 the standard utility allowance that she's entitled to because she has air conditioning, and that was $366. And then the total shelter got calculated automatically. It was populated automatically. It changed over to box 8 to figure out the shelter standard. It reversed back to box 9. It did a whole bunch of other magic, and we come out with an excess shelter deduction that she's entitled to at line 10B, which is a deduction off her income because she spends so much on her rent as compared to her income. When you subtract that, you get the final food stamp adjusted net income that she has. That's at line 10C. That automatically showed up at 1043.50 cents. So that's what her food stamp adjusted net income is. She meets the net income standard for a household of 1. I put that in. You see it's a gray number. Her income is less than that. So you know, because it's less than that standard, which you can fill in from the chart at A1, Appendix A1, you know that she's going to get some amount of food stamps, even it's a very small amount, like the minimal allotment. The rest of the calculations done below that box show the 1/3 presumption. The federal government presumes that you're going to spend 1/3 of your income on food, and that figure is called the benefit reduction. It's presumed that she's going to spend that much of her own income, and then you subtract that figure at line 13B from the maximum allotment for a household of 1, which you looked up on Appendix A1, 250, and because 314 is more than 250, you get a 0. But she doesn't get 0 stamps because she passed that box of meeting the net income standard for a household of 1. She gets the minimum allotment. And that's when you have to persuade her that the minimum allotment is worth using, it is worth applying. It's like getting free $20 every month for groceries. All right, but we're going to go a little bit further and go to the next slide. And we're going to look at some medical deductions that she has. And now we've asked her, what does she pay for her health insurance premiums? And we find out that she pays $170 for Medicare Part B, $40 for Part D. She buys a new pair of eyeglasses for $100 every 2 years and pays $50 for the eye exam. She sees the dentist twice annually and pays an average of $85 every time. She visits at least 1 doctor per month and pays an office visit copayment of $20 each time. Oh, she also has at the top paragraph of the bullet, I forgot she has 3 medications for which she pays $10 each month. Like, let's not forget those. And then bullet number 1, 2, 3, 4, 5, she has been told to take omega-3 by a doctor. He has directed her to take that to reduce inflammation in her joints and keep her dry eye at bay. And that supplement costs $30 every 3 months, or Clue, $10 a month. And then finally, she mentions, 2 of her doctors are 50 miles away, and she has to go see each of them twice a year. She drives a car, it gets 25 miles to the gallon. She complains the cheapest gas she can find is $4 a gallon. Obviously, we talked to her last month. It's probably more this month. Anyway, when you do the SNAP budget, taking into account these expenses that she could remember off the top of her head, her food stamps increased, her allotment increased, and we're going to look at the worksheet in a second. They increased to $54, and Ms. Fleur definitely agreed that the process of applying and recertifying for food stamps would certainly be worth it if she could increase her household income by $54 each month, because she would have to divert less of her income to food. So let's go to the chat. Folks, I'm going to see if you're actually still alert, alive out there. And let's do some yes, no's in the chat. First question, to determine the monthly cost that's attributable to eyeglasses and exams, divide 150 by 12. Now remember, Cindy said you can use these, you can list these costs as they occur, or you can amortize them over the year and get a monthly figure. I think that sometimes a monthly figure is going to be easier for some of these seniors for these recurring costs that they can predict, that they know they're going to have, because then they don't have to worry about reporting it to DCF when it comes up. They'll know it's already been calculated into their budget. So is that, what are people saying, Kathy? Do you divide 150 by 12 for eyeglasses and exams?
Val
Anyone
hasn't
answer?
said anything yet.
Well, we need to plow ahead. People, wake up. We're going to ask you the next one in a minute. The answer is no, you don't divide 150 by 12. That's not the way to come up with her monthly, because you had to pay really close attention. She said she pays 150, 100 for the glasses and 50 for the exam every 2 years. So you've got to divide that in half to get the yearly, and then divide by 12 to get the monthly. All right, folks, let's wake up. Next question, can supplements be included as a medical cost? Put a Y or an N in the chat if you're with us. Thank you, I saw some.
Okay, everybody's starting
All
to
right, they're
say
with
yes.
us now.
Yes.
They're with us now, and they got it. The supplements can be used as a medical cost. How about the next one? To figure her monthly dental cost, should you start by multiplying $85 times 2? Remember what she said? She sees the dentist twice annually and pays an average of $85 each time. So if you want to get the monthly, do you start by multiplying by 2? Yeah, I think I saw somebody write yes. That is a good start.
Yes,
You got to first
yes.
multiply it by 2 to get the annual, and then divide by 12. Yep, Daniel got it.
Okay.
Okay, next one, an easier yes, no. Can transportation be included as a medical cost? Give us a Y or an N in the chat. Okay, I'm seeing some Ys. Good. Thank you. And then the last one, a little bit trickier. To figure the monthly miles that she drives to those far doctors, do you multiply 100 by 2 and then divide by 12? Let me repeat what she told you. 2 doctors are 50 miles away. She sees them each twice a year. 2 doctors 50 miles away. She sees them each twice a year. Do you multiply 100 miles by 2 and then divide by 12? Okay, I see an N. I like that answer. So what you have to remember, what you have to remember is it's 100 miles round trip just for one doctor. So if you want the cost for one doctor, you would multiply by 2, because she sees that doc twice a year, and then divide by 12. But there's 2 docs. So you probably want to use 200 miles multiplied by 2 for 2 times a year, the round trip, and then divide by 12. Okay, don't forget, you can also use 44.5 cents per mile, as Cindy mentioned. If you don't want to go down this road with the actual cost, you're still going to need to figure out the mileage, but you can use 44.5, which is the current state rate. Let's look at the next sheet, next screen, Cindy. Okay, so again, the gray numbers are manual. The key thing I want you to pay attention to is all the wonderful numbers we put now in box 6. We've got the insurance premiums. I've grouped them a little bit differently than the way she said, but I've amortized them And then, gotten us down to a monthly figure. Her insurance premiums, that's a big one. Her glasses or eye exams, not huge, but it adds up. Her dentist and her doctor visit co-payments. Her transportation, not huge, but it adds up. Maybe she'd be better off with the 44.5. You got to check on that. But I would think with the cost of gas, maybe actual is going to work out better. And then you've got her RX, because we dug a little deeper and we found out she had some prescriptions. And now we find out she has total medical costs of $295.73, but she only gets credit for those that are in excess of 35. So I had to manually insert the 35 in there in order for the magic form, to automatically populate what is her excess medical expense. Her rent is all the same and her standard utility allowance is the same, but because her income shifted at her adjusted net income due to the medical expense being taken off at 7A, and then her income adjustment is 7F changed. Now she gets a different shelter deduction. And that all results in a food stamp adjusted net income, a dramatically different food stamp adjusted net income, where before it was like 1,300 or something. Now it's down to 652, which clearly is below the minimum. And when you multiply by the 30% presumption that she's spending some of her own money on food, you get a completely different number. I think it was 303 before, and now it's 196. And 196 subtracted, as I did manually, put in those numbers, subtracted from the 250 maximum allotment, that ends up with $54. Now, we might think that the difference between 20 and 54 is not huge, but for our clients, it makes a big difference. So this sort of demystifies the food stamp process for those of you who really want to figure out an accurate way to do the numbers. But I have a trick. Next slide. Florida Policy Institute has come up with a SNAP calculator. You answer questions. You're still going to need to know the medical expenses, but you answer questions. It might be easier to use. It might be a little less confusing for people who found that worksheet kind of weird. So I went ahead and used Ms. Fleur's facts, and I did the SNAP calculator yesterday, and lo and behold, I got $54. So it was accurate for Ms. Fleur. You do need to know the rules a little bit when you do the worksheet. You kind of need to know the appendix stuff, where to look that up. But if you don't want to look all that up, you can use the SNAP calculator and you can come up with a pretty good estimate. And I think that kind of closes Cindy and my presentation. Next slide.
Thank you, Val. Okay, so before.
Oh,
Sorry.
Cindy, let me just say one thing.
Sure.
In the files associated with this presentation, there is a copy of a blank worksheet just to show you what that worksheet looks like. You can just print it out and you'll see highlighted at the bottom of the worksheet the link to go get it, or you'll see the form number at the bottom left and you can just Google that form. Sorry, go ahead.
Oh, fine. So before we turn this over to Miriam to talk about the whole unwinding of the public health emergency and Medicaid, let me just reemphasize how important this deduction can be and how much it can mean to the pocketbooks for seniors, as Val's example showed us. And even if we haven't identified a particular, out-of-pocket medical cost that a senior may have, we really encourage them to tell DCF, if it seems to fit under the umbrella, of the categories we've mentioned. I didn't look to see if this held true with Val's case, but the common wisdom is that for a typical senior, every $3 less in countable income increases SNAP by about $1 up to the maximum benefit level. So we know that there can be an enormous benefit to claiming your excess medical costs when DCF is doing their SNAP budget. And we really hope that you'll keep this in mind with your clients. So let's go on to Miriam now, who can talk about unwinding of the public health emergency.
Thank you, Cindy and Val. That was great. I've worked, for those in the audience who don't know, worked for many years with Val and Cindy, and a hard act to follow. I was trying to think about what I was going to say, but what they were sharing was so important. I'm thinking I've got to learn this, and whenever I can, make sure folks know about it. And now on to the one of the other really timely issues that senior advocates and health law advocates should know about is, as Cindy said, the public health emergencies continuous Medicaid coverage provision will be unwinding at some point. And we want to talk about what will likely happen over the next few months. And this slide is quick overview of the presentation on that would be, I'm going to cover a little bit about the PHE's background, the shorthand for public health emergency, how the PHE's extended Medicaid provision has impacted enrollment, what the federal government has told states they have to do when the PHE ends, and the Florida seniors who are going to be at risk of losing Medicaid when the PHE ends, and what advocates and clients can do to help prepare. Next slide, please. So basic background is that the Families First Coronavirus Response Act increased the amount of federal funding that states could get for Medicaid by over 6%, which is a huge financial benefit for states. And as a condition of receiving that increase, states have been required to maintain enrollment of virtually virtually all Medicaid enrollees. So the bottom line in bold on that slide is that there has been virtually no disenrollment since March 2020. Even people who are no longer technically eligible for Medicaid have stayed on. Once the PHE ends, however, those who are no longer eligible or who don't complete the redetermination on time are going to lose their Medicaid. And we don't know the exact number in Florida, but the estimate is somewhere over 600,000 of current Florida enrollees. We also don't know when the PHE will end. The declaration has been extended multiple times. The current one goes to July 15th, but it's expected there will be at least one more 90-day extension and likely two more. And so on to the next slide, which shows just gives a visual snapshot of how this continued Medicaid coverage provision has changed enrollment. And this was 6 months ago, and it was already, enrollment had already increased over 1.2 million. It's now increased over 1.4 million. But the visual I want y'all to think about is that, look at the colored bars on the right. Most of the increase has been in TANF related. So that's typical, that's family related Medicaid coverage. But that group includes a number of seniors who are caregivers and receive Medicaid because they're taking care of a minor child. Seniors are most likely going to be in the SSI related group. That's the blue or light blue bar. And that's about 10%, and long-term care waiver. So those increases are not insignificant. Next slide, 5. So the federal government has been letting states know what they need to do to prepare and how they can go through this return to regular eligibility and redetermination processes. And it's shorthand for that is the unwind. The last declaration or guidance was from March this year. And they, long, extensive document. But the thing I want to highlight is that they told states that they have to comply with Medicaid's redetermination regulation, which is cited here in the slide. And that requires that states attempt a redetermination without even contacting the beneficiary to see if they're still eligible. And if that's not possible, then they contact the person and they have to give them 30 days to provide the information needed to for verification of ongoing eligibility. And prior to finding that someone is ineligible, the state has to consider all possible coverage groups for which the person might be eligible. So let's say somebody was getting Medicaid as a caregiver, and they're no longer eligible for that. They might be eligible for another group, an SSI-related coverage group. And the state is supposed to look at that. And then if somebody is terminated because they failed to provide the verification information, the state has to reinstate the person back to Medicaid, no new application required if the verification information is submitted within 90 days. And then if the decision is made that coverage is going to end, person's not eligible anymore, or they haven't completed the paperwork, the state has to give a minimum of 10 days advance written notice, including information on a fair hearing right, including that if the beneficiary appeals before the termination date, coverage has to continue pending a final hearing decision, and the state can recoup if the decision goes against the beneficiary. But stay tuned, that's a very important point. We're going to be, as I said, hundreds of thousands of people will be terminated. They'll be getting notice of their right to appeal. We'll be getting more information from DCF on how they're going to handle that. I'm going to skip over slide 6, please, and go to 7. Yeah, so we can get into the nitty gritty now of which Medicaid coverage groups with Florida seniors are most at risk of losing Medicaid when the PHE unwinds. And the first group would be the coverage group that's referred to as Meds-AD, Medicaid based on age and disability. The hyperlink in the title goes to a Q&A that gives a lot more detail about the background on this coverage group and what they need to do to prepare, what will likely happen. But quickly for now, it's just that these are people who are over 65 or been found disabled by Social Security Administration, SSA. They're over income though for the SSI payment level, but their income is still very low, less than 88% of the federal poverty level. And they are subject to the 2-year waiting period for Medicare after SSA determined that the individual was disabled. And as most public benefits lawyers know, many folks in the audience, if someone is found disabled and their income and assets are low enough, they can to qualify for Medicaid. They get on Medicaid right away, but if, with few exceptions, there's a 2-year waiting period before Medicare kicks in, if they're also eligible for Medicare. And the reason that a number of beneficiaries in this coverage group are going to lose their full Medicaid coverage is because they have become eligible for Medicare since March 2020, since the PHE's continuous coverage requirement went into effect. And again, just to review on Florida's Meds-AD coverage criteria, Medicaid ends when the person becomes eligible for Medicare. But because of the PHE, these people are still on. This is one reason we've seen these increases in enrollment. And that's going to stop when the PHE ends. They're going to lose Medicaid when their redetermination comes up. So I'm going to give an example. Let's say you've got your client, Betty, was found disabled in March 2019. Her monthly disability award was over the SSI limit, but she met the income and asset test for Meds-AD. So she went on Medicaid in March 2019. Everything's fine, going along. She thinks she's got ongoing Medicaid coverage. 2 years later, March 2021, she became technically eligible for Medicare. And were it not for the PHE, her Medicaid would have been terminated in March 2021, and she would have been told can enroll in a Medicare savings program. And the Q&A that's hyperlinked goes into more background on that, but that's a very important benefit people need to know about. So what are some things we can do to help these clients? One thing starting now is if some people in this coverage group, Meds-AD, may have progressed to the point where they really need assistance with activities of daily living, like bathing, managing their medications, and they may qualify for Florida's long-term care waiver. It goes to a higher income level, and that would keep them on full Medicaid. So they need to apply now because there's a long waiting list. And everybody, this group, every group, that whole big TANF group of low-income parents needs to make sure that their address is updated with DCF and create an online account with access if they at all possibly can. And one of the reasons it's important people get notices is that folks are going to lose their Medicaid, this group who've gone on Medicare eligibility, but they are eligible for this Medicare savings program, which is a very important benefit, and a lot of consumer protections. Next slide, please. So other impacted seniors, one group is medically needy. And that's the hyperlink in that second big group of bullets goes to a DCF brochure, which describes the medically needy program and how it works. Basically, if someone is eligible for Medicaid, so they meet the criteria for being in a low-income family, family-related or pregnant, or they're disability-related, but their income is too high for that eligibility group, they're enrolled in medically needy with a share of cost, which is like a deductible. It's always a large deductible, even if they're only slightly over income. And when people who are enrolled in medically needy have significant medical expenses, they can submit bills, paid or unpaid. And if those expenses add up to the person's share of cost, then they're enrolled in Medicaid for the rest of the month. So before the PHE's continuous coverage requirement back in March 2020, coverage would have been just for that single month. And the person would have to submit bills each and every month to show if and when their share of cost was met. But again, during the PHE, people who met it at one time stayed covered. They stayed on Medicaid without that huge hassle and potential interruption in coverage. Next slide. Some other examples of impacted seniors include caregivers, like grandparents typically, whose income has gone up and who are no longer taking care of a child who's a minor. So the youngest child turned 18. So remember that early slide with the picture graph and the huge yellow TANF enrollment. Again, typically parents who enrolled, many people, this scenario is very familiar to folks. Shutdowns and folks lost jobs in huge numbers back in March 2020, April 2020. And that was when we had the biggest increase in Medicaid enrollment. If you were in a household with a minor child and you lost your job, you were eligible for Medicaid, the adult. Typically, because Florida is a non-expansion state for Medicaid, most low-income adults are not, but a lot of those parents got on, and some of those folks were grandparents or seniors. So this hyperlink in the first background issue goes to a link on our website that it gives more background about what those income limits are for parents or caregivers. It's very low in Florida, as many folks know, only about 30% of poverty, or $463 for a caregiver and one child. So if, example, your client Zoe takes care of her grandson, John, who's been on Medicaid his whole life. And when the pandemic shut down her place where she was working in April 2020, she lost her job and she joined John in Medicaid. And she went back to work, as many people did. A month or so later, let's say she's making $1,400 a month. That's still very low income. It's not even 100% of poverty, but it's way over the Medicaid limit for parents and caregivers. It was $463. So Zoe John's grandmother has stayed on Medicaid for over 2 years, in spite of the fact she's way over income now because of the PHE's continuous coverage, and that she will lose when the PHE ends and she gets redetermined. She would then be enrolled in medically needy with a share of cost. And we don't have time to go into it today, but the Q&As, the hyperlinks go to tell folks, what they might be eligible for, these clients, and what they need to do to prepare. So, for example, if she's under 65 and her income goes up to 100% or more of poverty, she would be eligible for generous subsidies to help her get a health insurance plan in the ACA marketplace. The next bullet down, the hyperlink to minor child. Oh, go back to the stay on that slide for a minute. Thanks. That's another eligibility group, and the hyperlink explains why those caregivers or parents are going to lose coverage if the child has turned 18 since March 2020. So let's say John turned 18 in April 2020 or June after Zoe got on. She's not eligible because there's not a minor child in the household, and she's going to lose that. And the last bullet on this slide is I wanted to flag our long-term care waiver enrollees. So they are still very likely eligible. They're not going, most haven't gone out and gotten a job or increased income or anything like that. They still need that level of care, nursing home level of care. But if they don't get the notice and they don't timely provide the verification DCF's requesting, they are at very major risk of losing coverage or having a break in coverage. And many haven't gone through redetermination ever, or in the last 2 years. One of the slides we skipped, it was on auto enrollment, and some people in that coverage group were auto enrolled, but many were not. And so think about this client population on the LTC waiver, long-term care waiver. Many have dementia, living alone or with an overstressed caregiver, and knowing how challenging it can be to get your paperwork together for redetermination. It's really important that this group, that there be outreach and support for these folks, and that their address be updated. Absolutely. And if they are terminated, then because they are most likely still eligible, an appeal be filed right away before the termination date, so they keep getting continued coverage. So we're going to skip over slides 10 and 11, and just quickly go. I know we're about out of time. Potential problems. You can only imagine, the Florida has not gotten a lot of extra funding DCF to deal with this tsunami of terminations, and already an understaffed or this overstressed call center and very difficult, confusing notices. So keep in touch with us if you have these issues, or you have anecdotal accounts of problems like not getting through to the call center and being able to update your address. And next slide, 13. So I put this slide in, even though, again, it's most relevant for people who lose family-related Medicaid and need help enrolling in a Medicaid and an ACA marketplace plan. So that's, again, the big yellow bar of TANF folks. But since there are some seniors in that group, wanted to include it because it has that local contact information, the name, the phone, the email of the navigator in your area. And that's so important to be able to make that warm handoff to people who will be potentially eligible. And let's go to the last slide. We're just at Q&A time. As you can see, I mentioned earlier, it's like that the PHE will likely be continued, and we know it will go. We can pretty much go to the bank on that, because the federal government had told states they're going to give them a 60-day notice before the PHE ends. And so that would have been May 16th. That came and went. We held our breath. no notice to governors. And, COVID is still with us. It keeps looking like it's going to end. And then we still have a health crisis. So it has continued and likely will again, but there's the numbers are so huge. The people who are going to be impacted, many of them extremely vulnerable, that we are in a all hands on deck time now. Florida Health Justice Project has a website that we regularly update with the latest guidance and media and examples of clients who are impacted, and these Q&As on the various types of clients and what's going to happen to them and who they are. And if you have any ideas about outreach, education, you want another follow-up training, please don't hesitate to contact us. I'm Miriam Harmatz at Florida Health Justice Project, and my colleague, Katie DeBreer. And thank you. We'll have questions now, right?
Yes, but we don't have any questions today because
I have one. I have one.
Okay, good. Go, Val.
Miriam, can you elaborate a little bit more on the folks who are on long-term care waiver who might be at risk? Because some of these folks, I mean, are you saying that their income may have changed or simply that they won't get the notice that says they need to recertify?
Right. It's the second, or they don't respond, or there's a the hiccup in the computer. So they are technically eligible. They're not like the Meds AD group that's no longer technically eligible, or these parents or caregivers whose income has gone up. They are eligible, but we've seen, and many of you who, work in legal services field programs, people who, there was a mistake made and they erroneously got terminated and they shouldn't have been. And getting back on, not a big deal if the person's basically healthy and you can, go without services for a day or two or a week or two. But these folks need services daily. That's how they got into it. The program.
Is there a chance that they would have to if they messed up for a long enough period of time, that they'd have to get back on the wait list?
That would be like that you have the 90-day period to get back on. The problem is these folks are so vulnerable that within that 90-day period, and if their home health provider is not being paid, their managed care plan is not going to continue to provide home health services. So they will lose those daily long-term services and supports that keep them living safely at home. And that's, a huge risk for folks. And many were not auto-enrolled. We're trying to get more data on the exact numbers, but a huge number were not auto-enrolled. And the managed care plans are an obvious point of contact because the case managers are responsible for making sure that the enrollees' needs are met, et cetera. There has been some communication between DCF and ACA and the plans on the PHE unwind. So far, advocates and consumers haven't been part of those conversations, but we hope to be. And, we have to, it isn't all hands on deck. So anyone who, and outreach ideas are hugely welcome, has, and I know a number of groups do outreach and education to, senior centers, et cetera. Let them know about this. Make sure that the folks they know who are enrolled and their caregivers are aware that it's coming up. And the big things to do now are make sure your address is updated and get on the Access account if you possibly can. I know, many seniors cannot.
Yeah, that's going to be hard for some of these folks.
But they're supposed to be developing. We just heard some new mailer with a certain color that will alert people this is an important piece of paper. But this population, this is, we are, there's like a concern.
Yeah, a well-deserved concern.
Okay. Well, thank you, Val and Miriam and Cindy. That was a lot of important information for folks to remember. And remember, if you're watching today, that the session has been recorded. The worksheet that Val and Cindy referred to is in the session files. Also, a copy of the presentation PowerPoint that they did today. And you can find that by going to the virtual portal to this session, scrolling down underneath the video where you'll find the session files. And you will also find the link in the description to the evaluation, which I hope you do complete. And the recording will be made available for everyone to look at a later time once we finish out the conference. So thank you, y'all,
Kathy?
for coming. Yes.
Can I make one more point?
Yes.
Florida Legal Services is sponsoring a series of trainings on the food stamp program. If you're a big fan of SNAP, like Cindy and I are, where there's going to be 3 or perhaps 4 different sessions starting next month in June to look more in depth at food stamps. And I hope that we will cover that magical worksheet even at an even greater level of detail for those who are interested. So please look out for your announcements from Alexis at Florida Legal Services.
Okay. If we get the link for that, we'll add that to the session files as well. But hang on. Before we leave, we do have a question, and here it is. A married couple, the husband is eligible for his health premium to be covered and is not taken out of his, and it's not taken out of his Social Security. The wife gets Social Security through the husband's credit. However, the health premium is taken out of her Social Security income. How can the wife be, I don't know, if she, ineligible for her premium savings help or eligible? I think maybe there's a typo for her premium savings help.
I think if you're talking about the Medicare savings program, and this is a married couple, this is income based, it seems that it should be figured out based on the couple's total income, and that if they meet the income limits for a couple and the asset limit for a couple, that they should both get their Medicare premium paid by the state of Florida, either through the QMB program, the SLMB program, or the QI1 program. So I'm not sure. That's a weird one where the husband, it sounded like the questioner was saying the husband was getting his paid, but the wife was not. Or were they just saying it's coming out of Social Security? It doesn't matter where it comes out of. If you're looking for the help, you look to the Medicare savings program based on income. And then, of course, if they are paying it and they're ineligible for help from the Medicare savings program, if they're actually paying Medicare premium, then they can use that in the medical deductions, excess medical deductions. But perhaps I'm not understanding the question. Might be something that got lost in translation.
Okay.
Sorry.
No, I don't see.
Please feel free to reach out to Cindy or me or Miriam for that matter separately if you have a question about that.